You're watching Talk with Audrey. Welcome back. To address the disparities in breast cancer for Black women, Novartis recently announced the launch of More Than Just Words. It's a multi-year commitment to promote health equity in breast cancer care and the disparities in breast cancer for Black women. Joining me, More Than Words advisors, Dr. Monique Gary, a board-certified, fellowship-trained breast surgical oncologist and medical director of the Grandview Health Penn Cancer Network Cancer Program in Sellersville, Pennsylvania, where she also serves as the director of the breast program, and Ricki Fairley, co-founder and CEO of Touch, the Black Breast Cancer Alliance, and a stage 3A triple-negative breast cancer survivor and thriver. Welcome to both of you.
Thank you so much.
Thank you for having us.
My pleasure. Let me start with you, Dr. Gary. How common is breast cancer?
Breast cancer is too common. 1 in 8 women are affected in this country, and that means every 2 minutes a woman is diagnosed with breast cancer. And while we're diagnosed at similar rates, unfortunately, it's Black women who are impacted more severely because we are 40% more likely to die of our breast cancer. Under the age of 50, we have a higher incidence of breast cancer. And when you pare it down under the age of 35, these Black women are they're diagnosed at twice the rate when compared with their white counterparts. And this is a huge public health issue.
Why are Black women disproportionately impacted?
And the answer is not a simple one. It really is multifactorial. And what we know is that, health literacy, our ability to understand our bodies, to know our risk, to know our family history, those things are different in our communities. We don't like to talk about these issues. We know that there are differences in access to quality care and standard of care. And there's an earned mistrust as well when patients interact with their healthcare providers. And so we've got a lot of work to do to overcome some of these barriers.
So Ricki, as a breast cancer survivor thriver, you co-founded Touch, the Black Breast Cancer Alliance. Tell us all about the work that you do.
We believe that, breast cancer is a different disease for Black women. And we're trying to work on how we can help Black women deal with it. Looking at the science, looking at all the things that Monique just mentioned in terms of access to care, but also just knowing our bodies, knowing her stories, and talking about it at the kitchen table at home. Black people don't really talk about disease, really any disease, but we want to make Black breast cancer a top of mind conversations in the home. And more than just words, just give people more information and tools to use to kind of bring those conversations to the table. I always say the conversations that we're not having are killing us. So we have to have the conversations. And by bringing other breasties like myself to talk about it, and even our awesome celebrity Jasmine Sullivan to the table to talk about it and her mom's experience with it, just makes people, open up and talk about breast health. Our stories are really helpful in just getting the conversation going. And that's the point of this, talking about it, but also taking actions and empowering women with the tools they need to act on their health.
So that self-exam, of course, becomes very important, as well as making that appointment to have a mammogram. Dr. Gary, from your perspective, what are some of the primary barriers to care and the disparities in breast cancer?
Absolutely. I can give you a key one that this campaign really is focusing on, and that is the differential rate of screening. So due to the coronavirus, we know that screening rates were down this time last year, almost 90%. And we can do a much better job of encouraging women to get their screening, to do their breast exams. And one of the tools that we've developed is a tool to help women have a conversation with their doctor, because how many times are we in that exam room and we don't quite know the words to say, or you're a young woman who feels a lump and the doctor says you're too young for breast cancer, or, it's probably just something fibrocystic or some other word that maybe we don't understand. And so we want to make sure that women have the tools to be able to have a really educated and empowered conversation with their doctors, and that they're talking about it with their families, and that they are encouraging each other to go out and get screened and to begin to take some action against breast cancer. And that is really what this campaign is all about.
Ricki, from a patient's perspective, what are some of the challenges and realities that you faced after your diagnosis?
Well, primarily fear of death, right? So, you sort of are told you're going to die. My doctor gave me 2 years to live and I'm on 10. I'm very blessed, but just not knowing where to turn, where to go. And so by having a tool like this to know what to talk about with your doctor is so helpful. And so, because you are petrified when you're in that room. And sometimes you're alone and you don't even know where to start in terms of what to ask for. So we're trying to arm our women with information so they feel prepared, but also feel like they can advocate for themselves. Because when you look at women under 35, they'll often go present with a lump and not really know their bodies, and so really can't stand up for themselves. They'll get dismissed by the doctor and then go away and come back later, and they're 6 months later, they're metastatic. So it's also knowing how to advocate for yourself, knowing you're normal, and being able, having check your breast so something feels strange and you can ask for help that you need.
So let's talk about more than just words. What is Novartis doing in that program to help address some of the disparities, and what are some of the goals?
Well, Dr. Mo and I are working together with another breasty friend of ours, Jamil Rivers, and also Jasmine Sullivan, to bring a celebrity voice to this conversation. Her mom recently had breast cancer. So we're just trying to build awareness and build and educate and give people tools to use to kind of close that equity gap. So it's so important to talk about it, put it on the kitchen table, talk about it with your families. And we're really hoping that young women embrace the conversation from Jasmine Sullivan, because we feel like they can really be a voice into the household. Hey, mom, did you get your mammogram? Hey, grandma, have you checked your breast? So just, educating young women so they feel good about themselves and being able to understand what they need to do with doctors and asking questions, but also kind of be the entry point to the family.
Ricki, as a survivor thriver, what words of advice do you have for Black women who are facing a breast cancer diagnosis?
Check the breast that you love. I know you have a pair every month on the same day. Get into a routine, know you're normal, and know when something isn't right, and fight for yourself. And if you don't feel like you're getting the care that you need, find another doctor. Unfortunately, most doctors aren't like Dr. Mo and aren't embraced when they come with, and present with a lump. So knowing you're normal and being able to stand up for yourself and get the care that you need. And go to our website, morethanjustwords.us, for the tools.
And Dr. Gary, I'd ask you the same question from a physician's perspective. What words of advice do you have for Black women facing a breast cancer diagnosis?
My advice to Black women is that you are the most important person in that conversation, in that exam room, in your life. And it is so important to put yourself first. And that means prioritizing your health. That means doing your self-breast exam. It means going to the doctor, getting your mammograms. It means being an advocate and understanding that the most important part of the conversation includes you. We want every woman to feel empowered to make these decisions, to speak up for themselves, and to get the care that they need.
Amen. Give us that website one more time, please.
You got it. morethanjustwords.us. And on all social media platforms, we can be followed at MBC Dialogue. And our hashtag is #MoreThanJustWords.
Wonderful. I want to thank you both for joining me and for sharing this really important information for Black women so that we all know about the importance of taking charge of our health and our breast. As I always say, informs empowered.
Thank you for having us.
Thank you so much.